The title of today's talk is Prostate Cancer: Symptoms, Treatment, Prevention, and Empowerment. Start off with the symptoms. Usually there are none. We can just get right to the point. Usually there are no symptoms. But if there are symptoms, it could be prostate cancer, but usually it's due to a benign growth, a benign enlargement of the prostate gland. And those tumors are not dangerous in and of themselves. But the symptoms are an interruption of the urine flow or cessation of urine flow, the blood in the urine, pain in the pelvic area. These are some of the symptoms that could be there. But the symptoms that we have can be detected by the physician and by blood work. There are two tests that are commonly used. One is what's called a PSA, which is determined from blood work. The lower your PSA, the better. You want it below 4. But even if your blood work shows a normal PSA, I think mine was 2 when I was diagnosed with prostate cancer 2.5 years ago. 30% of people with prostate cancer have a normal PSA. The other exam is a digital exam where the physician comes up the rectum with his finger and feels the prostate. And it might feel a little lump or something unusual about it. And that was the case how mine was found. My PSA was normal. Now let's look at the PSA. A normal PSA in and of itself is not enough. You want to know, did it increase? See, if you had a normal PSA of 2, but a year ago you had a PSA of 1, that's a sign. So you can never just go by the PSA itself. Now the digital exam, what he said to me was, he said, well, just give yourself peace of mind, have it looked into. So I had it looked at. We had a sonogram made, ultrasound. We had an ultrasound made, and it couldn't rule out prostate cancer. So then we went to the biopsy. And the biopsy, they come in to the rectum, take out 10 samples out of your prostate gland. And again, it's not really painful, it's just uncomfortable. They take that and and you get a diagnosis. Well, when you're going through this, you're also going through a whole mental aspect of your life. It is natural for people to feel intimidated. Oh my God, I have prostate cancer. What is that? You know, and it's normal to then hope. I hope I don't have prostate cancer. And everybody knows, I hope it's not prostate cancer. Well, guess what? When you hope it's not prostate cancer, you're going to be intimidated by the possibility it's prostate cancer. Intimidation. So you have to arise somehow to go beyond that intimidation. Well, my physician told me, if you tested positive. I said, that's great. He said, what? I said, I love the challenge. I'll get stronger emotionally, physically, and spiritually from this prostate cancer. And I kept repeating that. I will get stronger emotionally, physically, and spiritually from this prostate cancer. And I did. I became the strongest man in the world when I had the prostate cancer. And within 3 months, I was setting more world records after my prostatectomy. So the diagnosis, the ultimate diagnosis, is the biopsy. Now, when you get a biopsy, they can determine whether it's a little bit of cancer, moderate, or a lot. Mine was moderate. It wasn't a little, it was moderate. But also, more importantly, or as importantly, is how aggressive is that cancer? How much is its tendency to spread? Mine was not mild, but it wasn't severe. It was moderate. It was also a moderate. It was called a Gleason score. My Gleason score was 7. Now, 7 has 2 numbers. A 4 and a 3. If it's a 4 and a 3, it's much more dangerous than it's a 3 and a 4. Fortunately, mine was a 3 and a 4. But a high Gleason, the higher the Gleason score, the more dangerous it is. So the way I approached it, again, I'm a clinical psychologist by training, became something of an expert in prostate cancer because I had to deal with my situation. I wanted to help myself and others. I wanted to get that prostate out as quickly as I could. But at first, you have to look into what the options are. That's where the stress was. I actually felt happy during the whole time. It made me feel closer to God, closer to people, appreciated my life. Everything was more poignant, more beautiful. It was a great time for me. The stress was trying to figure out what procedure to use. There are many procedures.